preview for we're just getting started on the right knee. We're looking in the medial compartment, or the inside part of the right knee. Everything that you see is magnified 30 or 40 times on the screen, and right now we're just getting a good look towards the posterior horn of the meniscus, just examining that here. And so far this is checking out okay. As we come around here, it looks like this meniscus is in pretty good shape. Now, what we're going to see here in a minute is the problem in the cartilage. Look at that here. So here's an area where we've got loose articular cartilage. And we're going to smooth out the margins so the cartilage doesn't continue to get dislodged and become loose in the knee. But we can see here where the problem is. See how this is loose all the way over to here. So again, we're just trying to leave as much cartilage as we can, but anything that's clearly loose, I'd like to remove. And then we're going to do a couple things to try and promote some new healing once we have this kind of debrided and smoothed out as best we can. Happy with the way it's starting to look here. These edges look pretty firm. See here, it's a little bit loose, but I really don't want to take away too much. So what we have here, I'll make a little adjustment so we keep your hand. What we have here is an instrument called a pick. It's a little hand pick. And what this does is it makes little holes in the bone. So we're going to basically make some holes around the periphery and in the center of this defect. And we'll try and get over here in this area too. And our hope is that we can create a little blood supply here things to heal a bit. So you can see here how we just work our way around the edges of this defect. This will probably be the last one here. Okay, so now we're going to put in our shaver again, just to make sure that we don't have anything loose. a minute. Okay, Kim, so I'm going to put in a little probe. It does a couple things. It's going to, primarily I want to be able to kind of get an idea of exactly how big this defect is. I'm going to flush out the knee for a minute. Okay, so here's our probe. And there's black lines on it that are 1 centimeter apart. So we'll trace more in just a minute. So we're going to take one final measurement. You can see the black lines, and it's going to be about 1, 2 there, but really if we add in this one, that's going to be about 3.5. And then this way we're looking at 2. Okay, so let me see what that measures, and then we'll come back up on the video. Okay, so now we're going to have a look around the rest of the knee. Here's our shaver coming back in. This is some normal tissue in front of the anterior cruciate ligament called the ligamentum. We can remove that so we can see that is of no consequence really. And now here's the anterior cruciate ligament behind this. Right here you can see the base of the ACL right here, and then it runs up in between the medial lateral femoral condyle, and the posterior cruciate ligament inserts up here off to the right. And that anatomy looks pretty normal. So now we're going to see what we can do about getting into this lateral compartment. And right off the bat we can see you've got some chondral damage here as well. So here's our shaver. So far the meniscus is looking okay, but you can see at the top of the screen that this condyle's got some problems. So we're going to get a better position and have a look at that possibly. Okay, let's drop the table a little bit, please. Okay, so we're having a look at the posterior horn of this lateral meniscus. So far it's checking out fine. See, there's some loose pieces of cartilage that we're flushing out from the knee. More loose pieces of cartilage. A few more. So these little pieces of cartilage can cause a lot of inflammation in the knee. They tend to get reabsorbed over time, but the bigger pieces can float around loose and really cause some symptoms. This is actually the meniscus that we're trimming back just a little bit. This injury to the articular surface. Look at that right there. This is most likely where some of those loose pieces are coming from. So we're going to work on the edges and see what we can do to stabilize this a little bit. Now you might be a very, very good candidate, even though it's still considered somewhat experimental by the insurance companies. You might be a very, very good candidate for our treatment with either platelet-rich plasma or even some stem cells from your bone marrow. And we're going to talk about that in the office, just to go over the pros and cons of doing that and what our expectations would be. But you're so young and you have these discrete lesions on both sides of the knee. So it sure would be nice if we had some way biologically to get these areas to heal a bit. Once we've got the loose pieces removed from the knee, then I think that would be the next thing to consider, possibly. Okay, so we're getting ready to use our pick again. And just like we did on the medial or inside part of the knee, shaver and just make sure that there's nothing loose. You can see we've worked on the edges to try and stabilize the margins so that those loose pieces aren't flaking off like they have been. So as you touch the margins here, they feel pretty firm. Especially back here where this was really loose before, and that looks a little bit better. Okay, so we're going to stop here. Next we're going to look at the kneecap and see if there's any issues that we need to address there. We're going to come down here like this, and as we would suspect, you've got some erosions in the articular surfaces of the trochlea, which is the part right here. Also underneath the patella, which is at the top of the screen. That's your kneecap here. Okay, Kim, so this is the trochlea down below. I think I've got the margins to a point where, see, the normal articular cartilage is this smooth stuff over here. Here's the line where the normal cartilage stops, and here we're getting into what's left of the cartilage is very thin, and in some areas are all the way down to the bone underneath. Down here is going to be your anterior cruciate ligament. So most of the trochlea is involved in this process, unfortunately, where you've lost this cartilage. Working my way around the edges to make sure there's no loose pieces. Okay, and now as we look up at the patella, we can see the problem here, where this patella is no longer smooth. Over here it looks pretty good on the lateral facet, but as we come over to the medial facet especially, we see some irregularity and some roughness in the cartilage. So we're doing a bit of a chondroplasty to smooth it out. I think this will be the end of the video. We're going to make sure there's no loose pieces in the knee, and then we're going to get you back to the recovery room. So I really hope this does the trick for you. Obviously you're young, and there's no great answer when someone's got this amount of chondral injury in all three compartments of the knee, and that's why we're going to talk about some of the other newer things like platelet-rich plasma and stem cells to see if that might be an option for you. Because if we can get you to a point where your knees even heal a little bit, that would sure be a beneficial thing since you're only in your 30s. So we're going to go off on the video. If there's anything else interesting, we'll come back up on the video, but otherwise I think we've seen just about everything that we need to here. So good luck to you now. Bye-bye.